Ebong Tilong, a name that once went unnoticed, is now synonymous with one of the most brazen healthcare fraud cases in recent memory. Tilong, along with his wife Marie Neighbor, orchestrated a massive scheme that defrauded Medicare of over $13 million. Their weapon of choice? A seemingly innocuous home healthcare company called Fiango Home Healthcare Inc. The couple, driven by greed, manipulated the healthcare system for their personal gain. They submitted countless false claims to Medicare, billing for services that were never rendered or were entirely unnecessary. Their scheme, built on deceit and fueled by a thirst for riches, ultimately unraveled under the weight of their own lies. The Tilong case serves as a stark reminder of the pervasive nature of healthcare fraud. It highlights the urgent need for increased vigilance and stricter measures to protect vulnerable patients and taxpayer dollars. This is a story of greed, betrayal, and the pursuit of justice that spanned continents. At the heart of this elaborate scheme was Ebong Tilong, a man who presented himself as a legitimate businessman, but operated in the shadows of deceit. His cunning and calculated approach allowed him to exploit the complexities of the healthcare system for years. Tilong's greed knew no bounds as he siphoned millions from Medicare, the very program designed to provide essential healthcare to vulnerable Americans. Tilong's wife, Marie Neighbor, proved to be a willing and active participant in the fraudulent enterprise. She played a critical role in the day-to-day operations of Fiango Home Healthcare Inc., facilitating the submission of false claims and managing the illicit proceeds. Neighbor's involvement underscores the fact that healthcare fraud often involves a network of individuals, each playing a crucial role in perpetuating the scheme. Together, Tilong and Neighbor wove a web of deception that ensnared countless unsuspecting individuals and institutions. Their actions were not victimless. Every dollar fraudulently obtained represented resources diverted from those who genuinely needed care. Fiango Home Healthcare Inc., a seemingly legitimate home healthcare provider, served as the primary vehicle for Tilong and Neighbor's fraudulent activities. The company, far from its stated mission of providing compassionate care, was nothing more than a front for their illicit activities. Through Fiango, Tilong and Neighbor systematically submitted a barrage of false claims to Medicare, billing for a litany of services that were either never provided or were entirely unnecessary. They exploited the trust placed in healthcare providers, taking advantage of a system designed to help those in need. The couple's audacious scheme went undetected for years, highlighting the challenges in identifying and preventing healthcare fraud. Their success relied on a complex web of fabricated documents, forged signatures, and a network of complicit individuals who turned a blind eye to their activities. Not content with defrauding Medicare, Ebong Tilong's criminal enterprise extended beyond healthcare fraud. He established Quality Therapy Services, or QTS, a shell company designed to further his illegal activities. QTS, devoid of any legitimate business operations, served as a conduit for Tilong's ill-gotten gains. Through QTS, Tilong funneled funds obtained through the Medicare fraud, concealing his income and evading taxes. This calculated maneuver allowed him to further profit from his crimes while insulating himself from scrutiny. The use of shell companies like QTS is a common tactic employed by criminals seeking to launder money and evade taxes. These entities, often registered in jurisdictions with lax regulations, provide a veneer of legitimacy while obscuring the true source of funds. Section 5. The long arm of the law. The reign of deceit orchestrated by Ebong Tilong and Marie Neighbor eventually unraveled under the weight of their own lies. The Federal Bureau of Investigation, alerted to irregularities in Fiango's billing practices, launched a comprehensive investigation. The investigation, spanning several years, meticulously pieced together the couple's elaborate scheme. Investigators pored over countless documents, conducted numerous interviews, and followed the money trail, ultimately exposing the true nature of Tilong and Neighbor's criminal enterprise. The case against Tilong and Neighbor serves as a testament to the tireless efforts of law enforcement agencies in pursuing justice and holding perpetrators of healthcare fraud accountable. Their work underscores the critical role of whistleblowers and the importance of public vigilance in reporting suspicious activities. Section 6. Justice delayed but not denied. In August 2017, Marie Neighbor faced the consequences of her actions. She was sentenced to 75 years in prison, a stark reminder that the pursuit of justice, though sometimes delayed, is rarely denied. Neighbour's sentencing marked a significant victory in the fight against healthcare fraud, sending a clear message that such crimes will be met with severe penalties. Ebong Tilong, however, had other plans. On the morning of his scheduled sentencing, October 13, 2017, he absconded, becoming a fugitive from justice. Tilong's flight from justice only deepened the resolve of law enforcement agencies to bring him to justice. Despite Tilong's attempts to evade accountability, he was sentenced to 80 years in prison on December 8, 2017. The court's decision sent a resounding message that those who seek to profit from exploiting the healthcare system will be held accountable regardless of their attempts to flee or obstruct justice. Section 7. Captured and returned. The extradition of Ebong Tilong. Ebong Tilong's flight from justice proved to be short-lived. In January 2019, after nearly 15 months on the run, he was apprehended in Cameroon, his home country. Tilong's capture marked a crucial step in the pursuit of justice, demonstrating that the reach of the law extends far beyond national borders. Tilong's extradition, however, was far from straightforward. It required extensive diplomatic efforts and cooperation between the United States and Cameroon. The case highlighted the complexities of international law enforcement and the importance of collaboration in combating transnational crime. After more than 2 years of legal proceedings and diplomatic negotiations, Tilong was extradited to the United States on December 10, 2021. His return to U.S. soil to face justice marked a significant victory for international law enforcement cooperation and sent a powerful message to fugitives seeking to evade accountability. Section 8. A historic extradition, Cameroon and the United States. Ebong Tilong's extradition from Cameroon to the United States marked a pivotal moment in the bilateral relationship between the two countries. It represented the first ever extradition from Cameroon to the US, setting a precedent for future cooperation in combating transnational crime. The extradition was the culmination of years of collaboration between law enforcement agencies in both countries, including the FBI legal attaché in Abuja, the FBI Houston field office, and the Cameroonian government. Their joint efforts demonstrated the importance of international partnerships in upholding the rule of law. Kenneth Polite Jr., the Assistant Attorney General, acknowledged Cameroon's cooperation, stating that it demonstrates its commitment to the rule of law and its partnership with the United States in combating transnational crime. The successful extradition served as a testament to the strength of US-Cameroon relations and paved the way for future cooperation in matters of mutual interest. Section 9. Combating healthcare fraud, a global imperative. The case of Ebong Tilong serves as a stark reminder of the pervasive nature of healthcare fraud and its devastating impact on individuals, healthcare systems, and national economies. It underscores the urgent need for a multi-pronged approach to combat this growing menace. Strengthening law enforcement agencies, enhancing international cooperation, and promoting ethical practices within the healthcare industry are crucial steps in deterring fraud and safeguarding public trust. Public awareness campaigns can empower individuals to identify and report suspicious activities, playing a vital role in early detection and prevention. The fight against healthcare fraud requires a collective effort. By working together, governments, law enforcement agencies, healthcare providers, and the public can create a system that prioritizes patient well-being and ensures that healthcare resources are used responsibly and effectively. The pursuit of justice in the Tilong case serves as a beacon of hope, demonstrating that even the most elaborate schemes will ultimately be exposed and perpetrators held accountable. This case, one of many in the realm of healthcare fraud, is notable both for the extent of the fraud and the severity of the sentence Tilong received, 80 years in prison. An unbiased evaluation requires considering the scale of the crime, the systemic implications, and whether the punishment was proportionate. We know Tilong and his accomplices orchestrated a large-scale operation where they billed for non-existent services, submitting claims for medical services that were never rendered. They misused patient information, which included using patient identities, often without consent, to justify false claims. They exploited vulnerable populations as they targeted individuals whose personal information could be easily misused. The monetary loss attributed to this fraud is staggering. Such actions not only deplete taxpayer-funded healthcare programs, but also undermine trust in systems designed to assist society's most vulnerable members. Talking about the punishment, 80 years in prison. An 80-year prison sentence for a non-violent crime is severe by any measure. To assess its fairness, several factors should be weighed. The first is proportionality. The punishment seems disproportionate when compared to sentences for other crimes, including violent offences such as manslaughter or armed robbery, which often carry significantly shorter sentences. For example, violent crimes with physical harm or fatalities may result in sentences ranging from 10 to 30 years. The second is deterrence. The sentence undoubtedly sends a strong deterrent message, warning others of the severe consequences of engaging in large-scale fraud. However, deterrence can be achieved with shorter sentences that include restitution and other penalties. Thirdly, is restitution versus incarceration. A lengthy prison term removes Tilong's ability to contribute to repaying the defrauded funds. A balanced approach might have combined incarceration with financial penalties, asset forfeiture, or enforced restitution. Furthermore, considering cost to society, imprisoning someone for decades is expensive for taxpayers, raising the question of whether such a sentence achieves justice or burdens the system unnecessarily. Now let me talk about broader implications. The healthcare system. Fraud cases like this strain healthcare programs, leading to increased scrutiny, stricter regulations, and potential reductions in access to services for legitimate beneficiaries. Another very implication is African diaspora stereotypes. High-profile cases like Tilong's risk perpetuating negative stereotypes about immigrants, especially Africans in the diaspora. It is crucial to highlight that this case is not representative of any group, but rather of an individual's actions. I must say the justice system's sentencing disparities come under scrutiny in cases like this. Many observers question whether the punishment truly fits the crime or reflects systemic inequities. While Tilong's actions were undeniably criminal and harmful, an 80-year sentence may seem excessive when considering the non-violent nature of the crime and the broader context of criminal sentencing. A more proportionate punishment might include a shorter prison term reflecting the need for accountability but not excessive incarceration, mandatory restitution requiring Tilong to repay the stolen funds as much as possible, community service or other reparative measures using his time to contribute positively to society. This approach could achieve justice without veering into overly punitive territory, aligning with principles of fairness and rehabilitation. In conclusion, Ebong Tilong's case underscores the significant consequences of healthcare fraud and serves as a deterrent. However, the 80-year sentence raises questions about proportionality, fairness, and whether justice is best served by such severe punishment. A more balanced approach might better address both the harm caused and the potential for restitution while still holding offenders accountable for their actions.